Well, first of all, I want to thank the invitation to this session, which I find extremely interesting, and I'm fascinated to see how many people we are around here, and to give me this opportunity. And I also want to thank Van Rompuy, who very much speeded up a couple of my slides because he already actually presented the data. The first one is this one. He mentioned that about 90% of our time is spent indoors. This is based on a population-based study in 6 cities around Europe, 7 cities around Europe. And it shows that it's not only about 90%, but it also varies extremely little between the different countries and between these different cities. It doesn't really reflect the local climates or anything that one might think. I want to first list some challenges for energy efficiency improving renovations in Europe. There are about 200 million residences in Europe, about 700 million rooms, total floor area which is larger than Flanders. Not much larger, but larger. The constructions and materials of these buildings represent local climate, ecology, history, culture, technologies, and economies for the past 200 years. And only a few percent of these are replaced or renovated in any given year. And I think I want to highlight very much this next step. The Energy Performance of Buildings Directive and the greenhouse gas reduction targets of the EU, if they are to be met, the critical bottleneck is the availability of building assessors, renovation managers, technicians and laborers, and with the necessary professional skills, practices and ethics. The reason for this is that, first of all, we need like 3 or 4 times more than what we have now. And I can't easily imagine how these are educated. The second thing is that renovating buildings is technically much more demanding than building new buildings. And the building sector is much more experienced in building new buildings than renovating old ones. So I think that this is a challenge. If this challenge is not properly met, it means that much of the renovation work will be not excellent investments, but terrible investments. And we've seen that after the past energy crisis of the 70s and early 80s, where a huge lot of mistakes were done, and they're still being paid for. Buildings age like their occupants do. You shouldn't expect a building to stay as new. It doesn't. Structural cracks and hidden water leaks develop. Moisture condenses on cold surfaces, dirt accumulates, and mold grows on damp locations. The prevention, detection, and remediation are all important, but resilience is equally important and very equally much required. It requires observability of failures in risky components, self-drying of minor leaks by natural convection, cleanability of moisture and dust and dirt accumulating surfaces. And I think I always haunted by this, what my former professor Gunnar Greffe said already in 1985, that fundamental safety of a residential building must not depend on the functioning of any technical equipment unless its failure is immediately obvious to the occupant. To go on, I need to introduce you to a concept that some of you will know and others will not. This key concept is burden of disease, and its unit is DALY, Disability Adjusted Life Year. This was developed by WHO in the 90s to provide a common metric for different health outcomes. A burden of disease is a product of how many people are affected, how long are they affected, and how severe are the disease symptoms. One is, for the severity, the factor 1 reflects total paralysis from neck down or death. And for example, on the other end, 0.02 is like a sore throat. So this basically compares, put in the same level, one person dying 1 year too early equals roughly 400,000 individuals with a sore throat for a week. And this is being used in, for example, this table, which shows the indoor air quality related burden of disease in 31 European countries. It basically shows you 2 things. The contributions of indoor sources, which are on the bottom part, the red one, and the contribution of outdoor air into the indoor air pollution are similar in magnitude. However, if tobacco smoke, passive exposure to tobacco smoke is excluded, it's a separate analysis, the outdoor contribution exceeds that of indoor contribution in almost every country. But not by far. If tobacco smoke is included, it's a whole different ballgame. We come to that a little bit later. And the other thing is that there's huge differences between countries, both in terms of outdoor air pollution contribution and the indoor air pollution. The next slide presents from this Copenhagen economic study that I think you already mentioned, yes, which was published in 2012, and the report on multiple benefits of investing in energy-efficient renovation in buildings, the impact on public finances. It estimated the public health benefits from, on one hand, lower emissions from heat and power generation, and improved indoor air quality and thermal comfort. There's two scenarios for change up to 2020. One is the lower energy efficiency scenario, assuming that 15% of the total energy in the buildings is saved, and the other one is a higher energy efficiency with about 22%, showing that both of these are fairly realistic. So what factors would provide these benefits? One is, again, reduced outdoor air pollution, removal of indoor pollution sources, protection from dampness, cold and heat, sufficient and balanced ventilation, reduced indoor noise, and then something which I'm not going to cover in detail, which are the health benefits which also arise from increased access to daylight, reduced infections, improved productivity and learning, and mental health. So, go to a bit more detail in the first. Reduced ambient air pollution from heat and power generation. In OECD Europe, my numbers are not from OECD Europe rather than EU, so they're slightly different from Rompuy's, but they're essentially the same, so I'm not going to repeat them. In total, air pollution exposure from heat and power generation for buildings in Europe is responsible for the burden of disease of about 800,000 Dalis per year. 800,000 years of healthy life is lost in Europe as a consequence of the emissions which are generated by generating energy for buildings, heat and power. In total, exposure to, the estimated annual health benefits of the two scenarios. For the lower energy efficiency scenario, about 120,000 Dali, or 5.2 billion euros from the health benefits alone. And the higher is about 180,000 Dalis, or 7.7 billion euros. There's a big uncertainty in this. And the biggest source of uncertainty is that decreased use of solid fuels in residential heating would further increase the health benefits. But increased use could even nullify them. So if we start using biofuels in buildings as renewable sources of energy in a much larger scale than today, basically all these benefits can be nullified and actually turned upside down. That's a critical issue. The second was removal of indoor air pollution sources. Indoor sources, that again, other than tobacco, these cause a burden of disease about 700,000 Dalis, about equal to the previous one. These can be reduced by renovation codes and guidelines which require removal and replacement of off-gassing materials, volatile household chemicals, and unflued or unvented combustion equipment, including gas stoves and gas hot water heaters. But note, tobacco smoke remains by far the most important and easily removed indoor source, and indoor smoking bans have advanced tremendously in the past 30 or 40 years in Europe. We live in many countries, we live in a very clearly different world now. I mean, in many countries, the situation is that if you're not a smoker yourself, if you don't live with a smoking spouse, you can go weeks without actually smelling cigarette. That was not the case 30 years ago anywhere. The bill that was passed in European Parliament yesterday is one important step forward, but it needs to be continued. Reducing cold, dampness and heat. First of all, cold. Interestingly, there's more excess mortality in South than in the North Europe from indoor cold. In the north, the buildings are built for cold climate. In the south, they're not built for the cold days. And that's the difference. Sealed building envelopes and increased thermal insulation save energy and protect heat from cold. Protect health from cold. And the cost-benefit ratios of additional insulation, of course, depend very much on the state of the current building. For example, when I look at the buildings that have been built since 80s or in the 80s and since 80s in Finland, the energy consumption is already about 1/5 of the energy consumption of the buildings that were built in the 50s and 60s. So this has already been done in that sense. Dampness is responsible for about $200,000 per year in Europe in terms of health cost. Thermal insulation reduces water condensation and therefore also dampness, mold growth, asthma and other respiratory diseases which are attached to it. Heat, that's an interesting thing because that is very often ignored. We try to keep the heat in, and we forget that in many parts of Europe, and in almost all parts at some times, it's much more important to get the heat out than to keep it in. The traditional Mediterranean buildings provide natural convective cooling. I have a home in Italy and I have a home in Finland, and there's a huge difference between keeping both of them cool. But most Northern European buildings and other European buildings are very poorly prepared for heat. And this results in some rather tremendous excess mortality peaks that we've had in Europe. And for example, in just a couple of weeks' time in Moscow, 16,000 excess deaths in a heat wave. In West Europe, 60,000 in 2003 August. And something which needs to be kept in mind and is often forgotten, the benefits of Mediterranean cooling and North European heat conservation, they can be combined in the same buildings. There's no reason why you couldn't do that. But it doesn't happen if nobody thinks about it, or if you just think of one or and not the other. For the sufficient and balanced ventilation, there's interesting, very contrasting information. The Euroven consensus meeting of experts in 2001 concluded that in the existing building stock, increasing outdoor air supply improves perceived indoor air quality. Ventilation rate below 25 liters per second per person increases the risk of sick building syndromes, and ventilation above 0.5 air changes per hour decreases risk of dust mites. The HealthVent project, which published its results in this year, proposed a minimum health-based ventilation rate of 4 liters per second, a tiny fraction of the 25 per person. But if human bioeffluents are the only significant indoor air pollution source, which obviously in most cases is not the case, and in renovation, the other sources can and therefore should be removed. The natural ventilation by intake vents and vertical exhaust ducts is driven by outdoor-indoor temperature difference and wind pressure, and consequently in cold and wind these mechanisms waste heat, and in calm and warm they are insufficient. Therefore, balanced mechanical ventilation with heat transfer from exhaust to intake air has become the norm in Northern Europe. It ensures the set air exchange rate, recycles about 65 to 8% of the heat from exhaust air, filters up to 90% of the most harmful ambient air pollutants. But it's not sufficient for ambient air for convective cooling. You have to have large openable windows for that. Reduced indoor noise. Environmental noise, the burden of disease is huge, but it mostly comes from rather low-level annoyance and sleep disturbance affecting very large numbers of people for most of their life. But it includes almost in the ballpark of $100,000 from ischemic heart disease, which is much more serious consequence. Increased thermal insulation and double-pane windows significantly reduce outdoor air noise entering into homes, and increased insulation can also absorb indoor noise sources. So in conclusion, assuming maximum building replacement and renovation benefits by 2020 within EU, reduced outdoor air pollution could reduce the burden of disease by $160,000 per year, removal of indoor air pollution sources by $70,000, but removal of tobacco smoke indoors, $600,000. And that does not include the health impact on the smokers themselves at all, just for the rest of the population. Protection from dampness, cold and heat great uncertainties there, but the order of magnitude is 100,000. It could be much larger. Sufficient and balanced ventilation from 100 to 300,000 dallies per year. The upper end requires that we will remove much of the pollution coming from outdoor air, which modern systems do and achieve. And reduced indoor noise in the ballpark of 100,000 dallies per year. These benefits overlap to an extent. You can't add them up just flatly, but they all add up to several 100,000 dallies per year. That's clear. Finally, this is my hometown, Kuopio in Finland, and this is how clean air looks like. You don't see it. And I want to acknowledge the many projects where I've collected all these data, and with hundreds of basically co-workers in this project. There's NV, IAIQ, EBD from Indirect Housing by WHO, EBODE, which is funded by the participating institutes, HealthVent, which is just completed, I quoted that, and the responsibility of the presentation and mistakes and failures are mine, not the people who worked on these projects with me. Thank you very much.